Hello, I'd like to ask you a question first. What do you think is the number one killer in India? Yes, it is heart disease. Heart disease in India affects people at a much younger age than the Western population. Heart disease in India affects people in both urban and rural settings equally. And heart disease in India tends to affect people during their most productive years of life, causing a great amount of disruption in their families and affecting their health adversely. This question I think everyone should ask themselves. Am I at risk for a heart attack? This is a two-part presentation. You're now watching the first part. Now I'd like to ask you a few questions first. If you can answer the following. What's your blood pressure? Do you get it checked regularly? Is it more than 130 by 80? Is your bad cholesterol or LDL cholesterol more than 100 milligrams per deciliter? Do you have diabetes, or is your fasting blood glucose level more than 100 milligrams per deciliter if you do not have diabetes? Are you overweight? Do you smoke or use smokeless tobacco such as gutka or pan masala, snuff? Do you drink alcohol excessively? Is your exercise activity quite limited or none at all? Do you feel stressed often? Is there any family history of heart disease? The more yes responses you give, the higher your risk. Let's go over the risk factors. Poor eating habits, lack of exercise, excess weight, having high BP, high cholesterol, or diabetes, especially if they are uncontrolled, smoking or chewing tobacco, excessive alcohol, stress, and factors such as family history of heart disease at a young age, genetic makeup of Indians, and so on. Now, except for a couple of these risk factors, everything else is modifiable, meaning they can be changed through changes to your lifestyle. I put in the title common theme for a reason. If you look closely, you'll notice that these are the same risk factors that you can apply for developing or worsening of high BP or high cholesterol, diabetes, even stroke, and so on. Basically, our lifestyle is the one main factor that is responsible for many of these so-called lifestyle diseases, such as, again, high BP, high cholesterol, diabetes, heart disease, stroke. And there are, with just a few simple steps that you incorporate in your daily routine, many of these risk factors can be either completely eliminated or brought down to a point where they are not going to increase your risk for suffering a heart attack or any other significant health condition anymore. Alright, based upon what we've just seen, you say, I am at risk. Now what? Okay, let's talk prevention. Let's prevent that first heart attack from even happening. And let's start with food first. I have mentioned this in many of my previous presentations and I reiterate, home cooked food is the best. Make sure that you eat plenty of vegetables and make sure that you eat at least 2 to 3 fruits every day, whatever is seasonally available. By making your meals healthy, using healthy ways to cook, by using less oil, avoiding deep frying, using less salt, and taking some other basic precautions, you can make the home cooked food the best food in the world. And try and limit your consumption of red meat, which tends to have quite a bit of saturated fat, bad for the heart. And absolutely do not use vanaspati oil or ghee for cooking anything. Try and say no to fast food whenever possible. I know it's not easy, but unless you try, things won't change. So, fast food, you know what I'm talking about? Samosas, bhel puris, or the Western fast, I call it bad food, fries, burgers, pizza. And try and also stay away from the following foods as much as possible, such as sweets, bakery items, including cakes, pastries, rich in calorie content and saturated fat, and in some cases also the trans fats, which are extremely detrimental to the health of the heart. Junk foods, avoid them please. They are called junk for a reason, you know. They tend to have minimal to zero nutritional value overall. And things such as ice cream, butter, ghee, paneer, do not eat them too often. In fact, I would go so far as to say that avoid them altogether. I've gone into great detail about this particular aspect of food in the topic cholesterol, so you may want to see that to get more information. Staying active, this goes without saying that physical activity is going to be extremely helpful for maintaining a healthy heart. Really, the type of exercise that you do doesn't matter as long as you're doing it on a regular basis. And this is a statement that I once read in a medical journal a long time ago. Exercise only on the days that you eat. It makes sense, doesn't it? Now, the simplest way to exercise would be to walk for at least 30 to 45 minutes. Brisk walking is better than a slow walk. No matter what your pace, regular walking is a wonderful way to stay active. Now, there are other ways that you can burn calories and stay active too, such as house cleaning. If you have young kids, playing with them, playing any kind of sport, yoga, and so on. And a health tip for those with sedentary jobs who sit at a desk for 10, 12, 14 hours a day sometimes. Why don't you take walking breaks instead of just tea breaks? Every hour you would get up, move around, maybe walk in place or within the area of your office for about 5 minutes, and like I said, do this hourly. Do not sit still for long periods of time. If you're watching TV or on the internet, just get up, do push-ups, walk around, move, do something, but do not sit for a prolonged period of time. Whenever possible, climb stairs. Wherever possible, climb stairs if your knees permit. I mentioned also that watching less TV is going to be beneficial only because you watch less TV, meaning you have free time when you can do certain things such as exercise activity to get your heart back into shape. Dealing with stress is so very important. There is no question about it. If the stress level in your life is high, that does increase your risk for heart disease. Unfortunately, stress is widely prevalent across all age groups. There are, though, very simple and effective measures to deal with stress, and a couple of those are regular exercise activity and yoga. These are very effective stress busters. Eating healthy food goes a long way in maintaining healthy body and healthy mind. Practicing meditation is another effective way to deal with stress. And try and maintain work-home balance. And spending quality time with your family without the interruption of TV or the internet is going to be a great way to deal with stress also. Have no TV days, once or twice a week. Discuss with your family and try this out. In the free time that you find from not watching TV, you can devise activities that the whole family will enjoy. And try and enjoy nature whenever possible. This is so unfortunate that I'm having to mention this because for most people, especially in the urban setting, nature is something that they don't even think about on a regular basis, as there is absolutely no time to do so. But make time for it. And getting enough sleep is very important. Sleep early, rise early. Try not to watch the news too much. For that matter, I'd say do not spend too much time sitting in front of the TV or the internet. Um, Instead, spend that time with your family, read books, do some other activity that will give you enjoyment, and see how you feel. A few words about smoking. One word of advice: never smoke. If you are a smoker, you should quit now. As a smoker, you have a very high risk for heart attack, along with many other health problems that we've talked about in the topic smoking. Now, chewing gutka, zarda pan, or pan masala with tobacco is equally bad and does as much damage as smoking. So, quit this habit now. Do not forget to watch the second part of this presentation. Thanks for watching.